For decades, society shared a very specific, depressing view of retirement living. We pictured quiet, sterile nursing homes where sedentary seniors watched television and waited for visiting hours. But the baby boomer generation is rejecting that model. Today's active adult communities are expansive hubs designed for people who want to keep moving. These communities operate like a permanent resort. The daily schedule is packed with constant socialization, pickleball matches, and regular cocktail hours. This utopian rebranding hides a massive public health crisis that is expanding as quickly as the communities themselves. National data reveals a startling trend. 20% of adults aged 60 to 64 now report regular binge drinking. The crisis extends to sexual health. Over the last 10 years, sexually transmitted infection rates among adults over 60 have more than doubled. The glossy brochures for modern senior living failed to account for what happens when thousands of newly liberated adults are clustered together without oversight. To understand these numbers, we have to look at who is actually moving into these communities, the pioneers of the 1960s and 70s counterculture. High school graduating classes from the late 70s, like the class of 1979, reported some of the highest levels of recreational drug and alcohol use. For many, these aren't newly developed addictions. These seniors are carrying their lifelong social habits directly into their 70s. The biological reality is less forgiving. Older bodies become sluggish when processing substances, making a single drink far more intoxicating at 70. This metabolic slowdown triggers severe physical consequences, negative medication interactions, a sudden loss of balance, and fatal head injuries from falls. Retirement facilities are now finding their medical teams overwhelmed by a wave of alcohol-related injuries they weren't staffed to manage. The danger lies in the collision between old ingrained habits and a newly vulnerable biology that can no longer clear toxins from the system. The same collision is happening in the bedroom. Retirement hasn't slowed down the desire for intimacy. Seniors today remain highly sexually active. Several factors drive this trend: climbing life expectancies, late-stage divorces, and the rapid adoption of senior-specific dating apps. Modern medicine has accelerated this shift. Erectile dysfunction medications have effectively extended sexual lifespans by decades. However, this generation faces a historical education gap. Many grew up associating condom use almost exclusively with preventing pregnancy, rather than preventing disease. Because pregnancy is no longer a factor post-menopause, the use of protection among seniors has plummeted. This lack of protection has turned retirement hubs into hotspots for infection, with clinics tracking sharp spikes in chlamydia, syphilis, and HIV. By removing the fear of pregnancy without introducing modern health education, these communities have inadvertently created a new epicenter for disease. When a 20-year-old enters a clinic with a sudden injury or a persistent infection, doctors screen for lifestyle risks. But for a 70-year-old, those same symptoms are often dismissed as the inevitable decline of old age. This systemic silence is rooted in ageism, the false, deeply ingrained belief that older adults are asexual and inactive. This discomfort prevents both doctors and families from having the basic, necessary conversations about safe sex and alcohol consumption that could save lives. Solving this requires a policy shift. Facilities must implement proactive substance abuse screenings, like the CAGE test, to identify risk factors during intake. A parallel pathway for sexual health education is equally vital, reintroducing disease transmission basics to a population left behind by health messaging. Protecting this population means ending the practice of treating seniors like fragile children. Addressing this crisis starts with acknowledging them as the active, complex adults they have always been.